right. First of all, happy Halloween, everyone. I hope you're having a great day, and I hope you're going to have a lot of fun tonight with your family and friends. Looking forward to spending the night with my children trick-or-treating. They're at a really fun age to go do that stuff right now. And thank you for tuning in for another Thursday Thoughts. I'm Dr. Garrett Wegerif here at Pure Plastic Surgery. If you're interested in a consultation, please go to our website to check it out, and you can look into that at pureplasticsurgery.com. Today we're going to be going over some questions related to tummy tucks. I think we have a couple from our inbox that we're going to get to right now, and then I'm going to go over a few other ones that have been sent in.
Great, Doug. How do you know if just lipo will work or you need a tummy tuck?
All right, so this really comes down to the quality of your skin and the amount of laxity you have in your skin. If you have any overhanging skin around your belt line, tummy tuck is probably the right answer for you. Even if you don't quite have overhanging skin, but you have poor quality skin like very thin skin or a lot of stretch marks, tummy tuck might also be the right first step. Doesn't mean you can't get liposuction. It might just be a better second stage procedure for you. So those are the main things I would look at for determining what is going to be the best option for you. But always feel free to hit us up for a consultation, and we can review your pictures or see you in person and talk about that further.
Can I stay limit to practice any specific exercise after a tummy tuck procedure?
So I think you're asking are you limited on any particular exercises after a tummy tuck procedure? Eventually the question is no limitations at all after a tummy tuck procedure. For the first few weeks though, whenever we repair your muscles, we need your body to heal that area really well before you start stressing it too much. So for the first 10 to 12 weeks, say no heavy lifting more than 20 pounds, and no really vigorous exercise within the first 6 weeks, but then after that you can start getting back into your normal exercise routines, but no heavy lifting for those first 10 or 12 weeks, nothing like squats, anything like that, or core exercises, abdominal exercises, until that's really had a chance to heal in. All right, and now we're going to get into a few other questions I have here. How long will I need a rest before returning to normal activities like work or childcare? So most patients can return to most of their activities of daily living within 2 or 3 weeks after surgery. So you're getting up around and you're basically living your normal life. Again, like I just mentioned, you're avoiding vigorous exercise and heavy lifting up to that 10 or 12 week mark, but for most people that work desk jobs or normal child care stuff, you can get back to that in 2 or 3 weeks. What can I expect in terms of pain and swelling during the first few weeks? So pain is very subjective. Everybody responds to this a little differently. If you think you're squeamish with pain, I would definitely recommend you getting the Exparel medication, which is a local anesthetic that I inject at the time of the surgery. That really helps. It's a long-acting local anesthetic that really helps with the muscular plication discomfort for the first 48 to 72 hours. And after that, you're kind of on the downward slope in terms of your pain and recovery, and it's getting a lot better. Swelling, that's going to be there. It's going to be there for a little bit. Right after surgery, you have to expect that for a few weeks, but swelling can accumulate on the bottom of your abdomen for the first several months, even up to 1 year. After that, it should go back to a very baseline point where you're getting no more swelling at the end of the day. How do I properly care for my incisions and promote healing and minimize scarring? So this is really important. What we can do in the operating room is important part of the wound healing, but how you treat and take care of those scars afterwards is also very important. So the main thing that has evidence behind decreasing how prominent a scar is using some type of silicone product. So this can be silicone gel or silicone tapes after the initial 2 weeks of healing. So start using those products, and then the thing to avoid hypopigmentation of the scars is avoiding sunlight exposure. So make sure if you're going out into the sun, you're keeping it covered or using sunscreen. How soon will I start seeing my tummy tuck results, and will they change as swelling goes down? So you're going to see your results immediately. The day of surgery, you're going to notice a pretty significant change. But keep in mind, I'm pulling everything really tight, and you're actually in a real hunched over position for the first 2 weeks. as you slowly straighten up, as your body relaxes a little bit. So you're nowhere near your final result the first few weeks after surgery, and you just have a lot of swelling going on. So you need to be patient. You're going to see those dramatic results right away, but there's going to be a little plateau, and then those results are going to continue to get more and more refined as time goes on. So be patient with the recovery process, and it's going to look very good. But remember, wear your garments and get your massages. So speaking of that, do I need to wear compression garments, and for how long should I keep it on? So this is one of those things where we kind of have a minimum requirement, but the longer you can do it, it's probably going to help your results. So my minimum requirement is about 8 weeks after surgery, but if you can continue to use it up to the 3-month mark, it's only going to help your results.
Wait, we have a new question.
All right, new question. What do we got?
When can I wear an underwire bra after a breast augmentation?
After a breast augmentation, that incision is very small. So typically after about 6 weeks, it's completely fine to do that. For other breast procedures where we have a little longer incision, like breast reduction or breast lift, I would wait at least 8 weeks before you start wearing an underwire bra. All right. When can I comfortably sleep on my side or stomach again after a tummy tuck? You can start doing this around the 8-week mark. You may notice though, if you sleep on one of your sides, you'll have more swelling on that side when you wake up, and that's normal, and that will improve throughout the day. But I know some people are just side sleepers and they want to get back to sleeping on their side, so you can do it around the 8-week mark. What are the signs of infection or other complications that I should watch out for? Fortunately, infection is not super common within abdominoplasty. But the things you want to keep an eye on is any changes with fevers or chills, redness, or increased pain in an area. All right, and when are my follow-up appointments scheduled, and what will happen during them? Excuse me, everyone. So, follow-up is really important for your outcome of your procedure and for us to stay in contact during your recovery process. So your first post-op appointment, I call all my patients the night of surgery to check on you to make sure you're doing okay. Then post-op day 1, you're gonna have a follow-up virtual appointment with the nurses where you submit your photos and I review those photos. Obviously, if there's any issues, you'll come in early and I'll see you. If not, I plan on seeing all my patients in person on post-op day 5. And then your next scheduled follow-up will be at 6 weeks and then 3 months. Obviously, if you're having any issues or questions or concerns before those times, I'm happy to see you at any point. All right, everybody. I hope you all have a great day. Happy Halloween, and I will see you next week for Thursday Thoughts.